speaker is Dr. Farah Shroff, and she is an incoming Harvard School of Public Health Technique fellow in global health, a Canadian public health intellectual with expertise in global public health research and education. She works in the Department of Family Practice and the School of Population and Public Health at UBC. The emphasis of her research is envisioning and developing health for all. Her main areas of research are integrative health approaches and social justice from a feminist, anti-racist lens. With that, Farah, very glad to see you here, and the floor is yours.
Thank you so much, Reza, and it's absolutely my pleasure to be here. Thank you so much to all the other speakers. Thank you so much to Dr. Garg for organizing this. And I have really enjoyed all of the CINI conferences. I've loved working with all of the organizers, and I really want to thank you for the important work that you're doing. It's just my pleasure to join you today to talk a little bit about the work of Maternal and Infant Health Canada, an organization that does education, research, and innovation to improve the lives and health of women and children. We work in India primarily, as well as in Canada. The innovation that we do is integrative health systems. I'm sure you've already acknowledged the land, so I just want to express my gratitude to the Indigenous stewards of this land. And I just want to make sure that I know who all is here. If you don't mind raising your Zoom hands and just letting me know, I just want to know who I'm talking with. I'm guessing we've got lots of clinicians. Just hands, yeah. Researchers. Okay, fabulous. Students. Do we have some students here with us? Okay, thank you. And people who study South Asia, people who are like social scientists in South Asia. Maybe a few less than that. And I'm sure we have lots of other interested people in this topic. Yes, so welcome to all of you. So Maternal and Infant Health Canada, or MyCan for short, you are welcome to look us up on we have lots of different social media handles, Facebook, Instagram, Twitter, and our website is here as well as our email. We really do dream about a world in which all women and children are healthy. And as I said, we use education, research, and innovation to do that. And our innovation is the application of yoga and Ayurveda and other systems of integrative health promotion, particularly for health promotion and disease prevention. We are based mainly at UBC. We have a student club, a group of students who also run a club. We run webinars every 2 months, and our swan song big webinar that just happened was at the World Health Assembly 74. MyCan was honored that the premier event of the Ministers of Health around the world chose a MyCan event, and we did an event called Women Power, Politics and the Pandemic, Celebrating Women's Leadership. And it was an amazing opportunity. We just did that in May of this year. We have a Green College seminar series coming up, and the City of Vancouver declared February 12th as the International Day for Sexual and Reproductive Health Awareness. And so every year, MyCan does something on February 12th to honor the connections between India and Canada. And so we do these webinars, as I mentioned. We'd love to have you come to them. You're all welcome to the webinars. They're free. We have them every 2 months. And this month we have a study done in the province of British Columbia looking at maternity health services, July 13th. You're all welcome. So yeah, here's our website, which shows you how to get to our webinar page. Hope you can join us. And here, as I said, July 13th, you're all welcome to join us for this, Birthing During COVID-19 in BC. And here's a few of our educational events that we've done with different physician members. We also focus on Canada, and particularly during the pandemic, because of course, we were all meant to be going to India, but we Of course, couldn't. So this year has been really good for MyCan in terms of focusing here in Canada. Although I must say I miss India very much. I would be in India in a flash if there was any, any real possibility of being there. So we feel that our role is to educate Canadians about the lives of people in India, not just looking at poverty or difficult things, but actually it's the reverse, looking at how India can help Canada through yoga, through Ayurveda, through meditation. And also just to recognize that we live in a country which views itself as a land of global citizens, people who identify first and foremost just as members of this big human family. And we really do try to promulgate this idea that we all should care about each other because we are all deeply interconnected, which of course is a yogic concept, an Ayurvedic concept that we are all interconnected. So we are part of this movement of global citizenship. So our research, I'm going to talk briefly about this study that we're doing, looking at the possibility of Ayurveda and yoga as potential solutions to some of the maternal and child health problems in India. So we have collected our data on this. We did surveys, focus groups, and key informant interviews in India. All of the research was done in India. And despite the fact that the Ayush Ministry was created in 2014, it's something that really strikes me as curious, that there just hasn't been a lot of work done in this area. To me, it seems like such an obvious fit that for thousands of years, Ayurveda and yoga and meditation have existed in the motherland, and yet there are all these problems with female malnutrition, early childhood marriage, and early pregnancy, which then typically lead to postpartum hemorrhage and all kinds of problems during pregnancy, as well as childbirth, up to and including very high rates of maternal death. So to me, it seems like a really natural solution to say, well, we've got these made in India solutions, Ayurveda, yoga, meditation, nutrition, all of these beautiful ideas in terms of keeping people healthy, starting at a young age. If we were able to take the long view, starting with pregnancy, making sure that the fetus was grown in a healthy way, and Ayurveda is so good at that, yoga, meditation, all the speakers at this conference have really extolled the virtues of our South Asian forms of health promotion and disease prevention. But yet this is actually not being done. So you and I might think this would be an obvious solution, but it's not. And so right now we're analyzing the results of our data, which we collected interviewing Vaidyas, Ayurvedic physicians, maternal and child health experts, Ayurvedic educators. We went to Ayurvedic colleges, and health researchers. So what I have to say is surprising. It's one of those studies which is not at all something that I would have hypothesized at all. That the people who I talked to weren't as keen as me sitting here in Canada was. As you may know, that the maternal and infant mortality in India is still a rather big concern, partially because of steep social and economic hierarchies. And that is despite the fact that there is a very strong public health and women's rights movement in India, a strong public health infrastructure, brilliant physicians and researchers and public health experts who work within India with a very deep dedication to improving health within India. And as all of you know, there are long-standing traditions of health promotion, disease prevention, treatment, rehabilitation, and palliation, besides Ayurveda, yoga, and meditation. So the state of the newborn in India, if you just look at the neonatal mortality rate, you'll see on this map that it's not as good as we would like it to be. There are still about 1 million babies who die before their first birthday in the nation per year.
Farah, I just want to give you just a little time check, okay? So you got about 3 minutes left.
Sounds good. Thank you so much. So preliminarily, what we found in this study is that the recent creation of the Ayush ministry, which stands for Ayurveda, Yoga, Unani, Siddha, and Homeopathy, it does signal change. And yet the situation is much more complex. After all of these hundreds of years, the system in India is still seriously allopathically oriented. And so the kinds of changes that which we thought would be sort of natural and come quite quickly don't seem to be coming as quickly as we thought they would be able to come. So we believe that nutrition, and then within yoga, just focusing on breath, asana, shavasana, dhyana being meditation, those things have real significant potentials. We have seen, unfortunately, that within India, that the practice of Ayurveda is mixed with allopathy in some clinics. And what that means is that an Ayurvedic physician might actually tell a patient, come and I'll give you some churna, an Ayurvedic powder. And yet, unfortunately, that could be white powder, which could be some kind of an allopathic drug. And so we don't see as pure a practice of Ayurveda as we would like. And that's part of the reason for the complexity of this kind of a solution to maternal and child health problems. We find that the education system is highly variable, and that a lot of the people who end up becoming Vaidyas or Ayurvedic practitioners actually wanted to be allopathic physicians, and they couldn't get into allopathic medical school. And so as a second choice, they've opted for becoming an Ayurvedic physician. There is a bias in India, like the rest of the planet, towards having fast results, medicine that cures quickly. And there is still a lot more prestige in allopathic medicine. Now, on the bright side, there really is a resurgence of Ayurveda amongst large segments of the population, but most notably educated urbanites. Yoga, of course, has become ensconced globally. Every corner in Vancouver has a yoga teacher. I am a yoga teacher, and I have just seen the mushrooming of this practice over the past few decades. We see that the trendsetters within India are the lower middle classes. And so when we want to see change within India, the experts in public health always aim for that cadre of society. There's a double-edged coin with the current political climate right now. There are lots of complexities there. And what we know is that all change takes time, and that Ayurveda and yoga will truly resurface in India. It just might take longer than some of us want. We do have some upcoming studies right here on Turtle Island with Indigenous healers, which I won't have time to tell you very much about. I just want to end by saying that my connection to this topic is really the transformative potential of mother's love. That if we could have that love that most mothers develop in their hearts for their children and spread that love all over Mother Earth, we really would have a better world. Healthy mothers do make for a better world. Once again, here are our upcoming webinars for Maternal and Infant Health Canada. July 13th, we have one in September. We already have TAC Bundle talking about periods and menstruation on November 23rd. Thank you so much.
Thank you so much, Farah. It's always such a pleasure to listen to you speak, and I would love to spend even more time learning more about what you're doing. But one of the things that really resonated with me when you were talking about going to India and the potential that India has so much to offer to the rest of the world with respect to healing and integrative thinking. And there's that's so true. And it goes back to our mantra that we have at Canada Indian Network Society is the best of the East and the best of the West. And that's really the core of what we're working towards, is how do we take that great history and learning in India and merge that with the Western medicine. So thank you very much for that.